In 4 minutes, we will discuss OET speaking and how you should prepare for it at home, as well as what you should do in the exam. Then we'll look at a sample answer and discussion. So let's get started. Here, you're given, first of all, 2 role play cards. There's this one, and here it says you are the parent, and this is for OET nursing, by the way. You're the parent, and then here's a task. Now, this is not for you. This is for the person who is going to be talking to you, who we call the interlocutor. They're going to be the nice people who will communicate with you and answer your questions. I say nice because if you are coming here from the IELTS exams, you will see or you have experienced some attitude by those examiners. In OET, that's not the case. The person who is doing this role play with you, pretending to be the parent of a child, is usually very nice, and they will encourage you and smile with you to help you speak better, not really challenge you. You will do this candidate card. This is your role because remember, you're the healthcare professional. Since this is OET nursing and the same rules apply for any other OET field, you will be given your occupation as well as what you represent and your task. The tasks will have bullet points, and these bullet points will tell you what questions you should ask and how you should manage this conversation. So first of all, let's talk about the warm-up time, because that's going to be the thing that comes before all of this. In the warm-up time, it's you and your control. You can ask the interlocutor any questions based on what you see here. You can ask them about the setting. You can ask them, how should I say this? How can I pretend to do this? Again, they're not going to give you always all the answers you need, but it's important for 2 main reasons. One is to just warm up your tongue, just getting into the habit of asking questions. And 2, it helps you to understand the topic better and get some answers. This is important, especially to get some confidence and nervousness out of the way. Now, when you see their card, you should spend some time looking at what they will say. Now, in their card, we can see it's the Children's Hospital, and they are the parent. So you're the parent of a 5-year-old boy. You brought your son to the emergency department because he has been experiencing severe abdominal pain and vomiting. The nurse is assessing him in triage and has taken his vital signs. So your son has a problem. Your son is now with your spouse. So if you're the husband, the son is with the wife now and not present for the discussion. So this is important to understand because if you just read this part, you will be talking to the son. However, it's important to understand that the son is gone, so the parent is the one speaking on behalf of the son. So now you're going to be addressing the parent, which is why these kind of details are important. Now you want to look at not all of their bullet points, because remember, you're going to be focused on your bullet points. Your job here is to ask questions. Remember that? That's your main job, to ask questions. However, you want to predict what they will say. What is going to be their reaction? For example, if you see these bullet points, if you quickly glance through them, skim through them, you see that when they are being asked by you, how your son's condition developed, etc. They're going to be talking about the condition. They're going to be mentioning more details. They'll share something. These words are really key. They'll share something. They'll mention something. All right, so they'll provide details. They'll express their worry, and they will state that they will wait in the waiting room. So they are very worried, and they are going to be compliant with you because you will ask them probably to wait in the waiting room. So that gives you an idea of how the answers would be. Now, when you look at your card, this is the Children's Hospital. This is the situation you'll be looking at. And you're the nurse. This is your role. Now, here are your points. And in the note-taking time, or let's say the preparation time, the warm-up time, it's better not to talk too much to the interlocutor because you mainly want to spend more time at looking at your notes and your bullet points. Look at how you have to take care of this conversation. You have to introduce yourself, inquire, obviously ask. These are the questions you would be asking, which are mentioned here. But later on, also look at how you have to lead this conversation emotionally. You have to provide reassurance. Your son's going to be okay. Explain further details. Again, reassure. And this ending instruction is usually important to understand how we'll wrap this up. And you're basically going to ask them to wait in the waiting room. So this gives us a good idea. And now you're prepared mentally to get engaged in this conversation. How should you answer this and how you should prepare? Check out my other video that's going to come right after this in sequence. And if you haven't seen that already, please subscribe, like, and share as well. In the next video in 4 minutes, we'll discuss how you do an effective OET speaking sample.